Hello everyone. My today's topic of presentation is periodontal changes and challenges faced by the elderly population. In this pie diagram, we can see the prevalence of various periodontal diseases in elderly patient. The most common disease which can be seen in elderly patient is the generalized periodontitis, which represents 34.8% of the conditions. And the least common which can be seen is the periodontal health, which represents only 2.5% of the conditions. So the key changes which can be seen in elderly population is the tissue degeneration. This occurs due to reduced collagen production and slower healing, which can be seen in elderly population. This leads to decreased elasticity and resilience of the gingiva, leading to receding gums and greater exposure of the tooth roots. Bone loss. Gradual alveolar bone loss is common in elderly, which leads to weakening of the structural support of the teeth, making them prone to mobility and the tooth loss. Decreased immune response. Aging affects the immune system's ability to fight infection. This leads to reduced capacity to combat oral pathogens and increased chances of inflammation. Diminished salivary flow or the xerostomia or the dry mouth is a condition which can be age-related or also due to side effects of various medications. This leads to reduced natural cleansing action of saliva and increased plaque accumulation, leading to increased periodontal disease risk. Systemic health and its influence of periodontal health. The aging population is often affected by chronic diseases and health conditions that further challenge the periodontal health. The most common systemic condition that affect periodontal health is the diabetes. Diabetes, which is a common in older adults, this impairs the body's ability to regulate inflammation and healing process, which exaggerate the periodontal disease. The poor glycemic control, it can also accelerate the tissue breakdown. Cardiovascular diseases is a form of inflammation, systemic inflammation. And periodontal inflammation, this also contributes to systemic inflammation, which can worsen the cardiovascular conditions like the arteriosclerosis. Osteoporosis or the reduced bone density, which can be seen in elderly population, this does not only affect the skeletal health, but it also weakens the alveolar bone, leading to increased risk of tooth mobility and tooth loss. Respiratory infections are common in bacteria from the periodontal pocket or the biofilm. It can get aspirated into the lungs, leading to respiratory diseases such as pneumonia, particularly in bedridden elderly patients. So the problems which can be seen with aging is the anatomical, physiological, and morphological factors, the plaque control, post-response immune function, systemic and various psychological problems and diseases. The medication which the patient has been taken also impact the periodontal diseases. Structural changes which are seen with aging is the loss of alveolar bone and changes in the gum tissue, and the physiological changes which can be seen is the decreased salivary production and altered immune response. The dry mouth, which can be seen in elderly, which is a very common condition, it can hamper or it can impact the taste perception. Also, it can lead to increased prevalence of dental caries, oral malodor, and difficulty in speaking. So common periodontal changes which can be seen with the aging is the gingivitis. Gingivitis, this is an inflammation of the gums and the symptoms involves the redness of the gingiva, swelling and bleeding of the gums. Periodontitis, this is an advanced form of gum disease. The symptoms include the deeper pockets and bone loss which leads to tooth mobility and tooth loss. Risk factor in the elderly. So there are various risk factors like the systemic, there are various systemic diseases which are present in the elderly population which act as a periodontal risk factor. These are the diabetes, heart diseases, the medication, the patient which has been taken, and the lifestyle factors like the nutrition, tobacco use, and oral hygiene practices. So periodontal diseases. How the periodontal disease they impact the systemic conditions. In this diagram, we can see this is the periodontal biofilm or the dental biofilm. The bacteria which is present in this biofilm and their toxins, they get disseminated into the bloodstream and causing to various systemic responses. The microbial and inflammatory challenge, this triggers the hepatic response, leading to release of acute phase proteins from the liver. And these acute phase proteins They may promote oxidized low density lipophospholipid accumulation and arterial plaque formation. This further leads to increased chances of MI and stroke, and also it can lead to various complications of pregnancy. So these are the this diagram shows the periodontal disease and having its impact on various systemic conditions. So the challenges faced by elderly is the most common is access to dental care. It can be due to financial barrier or the transportation issues, cognitive decline. It can be due to impact of impact. It has impact on personal hygiene and self-care, physical limitation, difficulty in maintaining the oral hygiene routines. So how we can prevent or manage these conditions? We can do it by regular dental checkups. Oral hygiene practices like the proper brushing and flossing techniques can be given to the patients and dietary considerations. So, what is the role of caregiver? The support, caregivers, we can train them to assist with dental care, also encourage and educate the patient, raising the awareness about their oral health importance. So, in conclusion, we can say that there is importance of addressing the periodontal health in elderly, which needs a multidisciplinary approach to care. Thank you.